each of which innervates a single muscle fiber. More than 100 muscle fibers may be supplied by one motor neuron to form a motor unit, because in case of the skeletal muscles, if the nerve is stimulated at the same time, many fibers, nerve fibers get stimulated. At each neuromuscular junction, the axonal terminal loses its myelin sheath, axonal terminal, and forms a terminal arborization that lies in opposition to a specialized surface of the muscle membrane, termed as motor and plate. So here, in case of the skeletal muscles which are supplied with the somatic nerves, there are a special tissue known as the motor end plate is there, to which the nerve fiber is connected. That is the, here you can see the difference between the sympathetic and parasympathetic. The preganglionic nerve fibers in case of the sympathetic is very short, whereas the postganglionic adrenergic neuron is very lengthy, and the ratio is usually 1 is to 1 here, 1 is to 10 here, and the adrenergic receptors are present, may be classified as alpha or beta, which is in a target tissue, and the neurotransmitter released is norepinephrine. And in most of the ganglia, the cholinergic nicotinic receptor, acetylcholine is the neurotransmitter, especially in the autonomic ganglia in case of sympathetic pathway. In case of parasympathetic pathway, the preganglionic neuronal fiber is very long, and very near to the organ of innervation, it is going to have the synapse or the ganglions, and the neurotransmitter released is acetylcholine, and the target tissue has got the varieties of the receptors, especially the N and M type of the receptor. N is classified into NN in the nerves, whereas NM in the muscles. Whereas the muscarinic type of the receptors are classified into M1 to M5 type of the receptors. So this is the anatomical difference between the sympathetic and parasympathetic pathway. Both are originating from the central nervous system or the spinal cord. And this is a little more exhaustive, the difference between the central nerves, the parasympathetic and sympathetic nerves. Whereas this is the somatic nerves, of course, the autonomic nerves, in which there are parasympathetic and sympathetic outflow, both will be present. And in case of somatic nerves, motor neurons, it is very lengthy. There are no what you call as the synapse or junction or the ganglia, whereas directly it's going to innervate with that of the skeletal muscles with motor and plate, and the receptor subtype is the acetylcholine. The NN type of the receptor and NM type of the receptors are there. Whereas in case of the parasympathetic nervous system, here the preganglionic fibers are very long and the postganglionic fibers are short. And this is the ganglia, where in which this acetylcholine is the preganglionic neurotransmitter, and also the same is the postganglionic neurotransmitter, which will act on the muscarinic type of the receptors, usually muscarinic type of the receptors, especially on heart, blood vessels, viscera, eye and glands. And one thing you can find it here common is especially the autonomic nervous system is supplying to both the what you call as all the organs are supplied with both the systems. Whereas we can see, especially in case of the preganglionic fibers of sympathetic divisions are short, and the adrenergic nerves or the postganglionic nerves are long here, and the receptors are classified into alpha and beta. So all these organs do have either alpha or beta type of the receptor, and the adrenergic nerves or the cholinergic especially cholinergic nerves, acetylcholine is the neurotransmitter, and the muscarinic type of the receptors are present. Whereas in case of adrenal gland, adrenal medulla, the acetylcholine is a preganglionic neurotransmitter in everywhere, maybe central nervous system or autonomic nervous system. Whereas the adrenal medulla, adrenaline is directly released into the bloodstream whenever there is a fight or flight reflexes are needed. So please remember this particular chart so that you can understand it very easily. And here also you can see that the ganglionic, same thing, normal state. The acetylcholine is the neurotransmitter, especially in case of this is the first neuron and this is the second neuron. Whereas the first neuron is present in case of the central nervous system and it is traveling through certain distance and synapse with that of the postganglionic nerve fiber, wherein it is minus 70 millivolts are the resting membrane potential, whereas the nicotine is also going to make the excitation in case of the ganglionic stimulant and persistent depolarization, especially in case of the skeletal muscles. Whereas the adrenal medulla, epinephrine released by the nicotine is going to release the epinephrine in case of postganglionic fibers, and there is little depolarization is present. Whereas the adrenal medulla, the big quanta of the noradrenaline is secreted after stimulation of the central nervous system. What is the function of the autonomic nervous system? It is involved in fight or flight reflex. Here, the autonomic nervous system is the fight or flight, means whenever the situation comes, it will prepare the body to fight or run away or flight. That's the situation. Whereas it is useful in case of the exercise, excitement, emergency and embarrassment. Here you can see these cartoons. They are fighting with either a donkey and an elephant is fighting. So here they are going to fight or the loser will flight away, means run away. The parasympathetic nervous system is the one which is always conservative in nature. So it is active in rest and digestion during the digestion process. So it is the digestion, defecation and diuresis, urinary process. All these conservative processes are monitored by the parasympathetic division of the nervous system. And here you can see that the sympathetic nervous system is affecting, both systems are affecting on the body during the fight or flight respect. Here you can see a man who is ready to fight, and by the posture you can also see that he is ready to flight away, means run away. So what happens in an emergency situation? There will be salivation, little or viscous, then the bronchi are dilated and more air is coming inside the body and more oxygenation of the hemoglobin. Then the pupils are dilated widely and he is going to see more and more the environment and the skin. There is perspiration and sweating, especially the skin. And in the liver, what happens? Glycogenolysis, means the glucose is produced to supply the energy required. If the person is fighting or flighting, both the time the energy is required, that is secreted by the liver or the gluconeogenic property. In the GI tract, there is persistent peristalsis is decreased during the fight or flight. The sphincter tone, it is going to increase and the blood flow will be decreased to the GI tract, because during fight or flight, the skeletal muscles need more and more blood and more energy. That's why the supply to the visceral organs becomes less. Whereas in case of the heart rate will be increased, the force of contraction will increase, blood pressure also increases. In case of fat tissue, the lipolysis occurs whenever there is a fight or flight reflex is there. Then the fatty acids get converted to glucose also. Gluconeogenic property is there, and fatty acid liberation will be present. Whereas the bladder, the sphincter tone is increased, and detrusor muscles going to relax. The skeletal muscles, of course, there is a lot of blood flow is there, whereas the glucogenolysis is present, and the fat tissue deposited in the skeletal muscles get what you call as get descended and converted into the glucose to face the situation, especially the any drug which is acting on the sympathetic nervous system. It will cause all these properties: increase in the alertness, little or viscous saliva, and all the other properties. Here we can see the difference between the autonomic nervous system, neurotransmitters, and some of the receptors. What are all the different receptors? Please remember this particular graph is concerned. The parasympathetic nervous system consisting of the nicotinic cholinergic nerve receptors and muscarinic cholinergic receptors. So this is the one receptor subtype is NN in neurons or the nervous system. NN type of the receptors are present, whereas in case of the muscles, NM type of the receptors are there. So make this very clear, and the muscarinic cholinergic receptors are ranging from M1 to M5 type of the receptors are invented, and they are important. Of course, there may be M6 or M7 maybe, but the physiologically significant receptors are M1, M2, M3, whereas the pharmacologically significant only M1 to M3 receptors, whereas the M4 and M5 still they are not made as the pharmacological targets. And the sympathetic nervous system, alpha adrenergic receptors and beta adrenergic receptors are the two type of the receptors, whereas the alpha adrenergic receptor is classified into alpha 1 and alpha 2. The beta adrenergic receptor is classified into what you call as the beta 1, beta 2 and beta 3 type of the receptors. Once again, the same thing is depicted here. The sympathetic nervous system consisting of the preganglionic neurons and the type of the receptor present on the postganglionic neuron is nicotinic type. See? So then acetylcholine is going to act on the nicotinic type of the receptor. Then the adrenergic receptors which are present on the postganglionic site are the alpha 1 and alpha 2, beta 1 and beta 2, beta 3 type of the receptors depending upon the type of the organs. Whereas the parasympathetic nervous system, the preganglionic nerve fibers are long, and the receptor subtype is present on the postganglionic fiber is nicotinic subtype, and in both these ganglionic sites, acetylcholine is the neurotransmitter. And of course, the effector organs may contain the NN type, NM type, both nicotinic and muscarinic receptors. In case of nicotinic, NN, and the muscles do contain NM type of the muscles, these skeletal muscles, NM type of the receptors, whereas the smooth muscles do contain M1 to M5 type of the receptors. We will see where and which the different type of the receptors are distributed in future. So here once again difference between sympathetic and parasympathetic, as usual we have discussed it, because as this is a frequently occurring question, we can learn it more and more time. Origin is the dorsolumbar or the thoracolumbar. The nerves are originating from thorax and lumbar division, whereas the parasympathetic nerves, it's a craniosacral outflow, lumbosacral outflow and craniosacral outflow. Distribution is wide, especially the sympathetic nervous system. The parasympathetic nervous system, it is limited to head, neck and trunk, especially three regions. Ganglia of the sympathetic nervous system away from the organ supplied, whereas they are very close to organ of innervation in case of the parasympathetic nerves. Postganglionic nerve fiber length is long in case of the sympathetic nervous system, whereas in case of the parasympathetic nervous system, it is short. And pre to post ganglionic fiber ratio is 1 is to 10, 1 is to 20 or 1 is to 100 maximum, whereas it is less in case 1 is to 1 or 1 is to 2, and except in the our batches flexes and other thing, it's 1 is to 8,000, 1 is to 1,000, etc. The neurotransmitter, especially the sympathetic neurotransmitter, is the noradrenaline, whereas the major neurotransmitter in case of parasympathetic nervous system is the acetylcholine, whereas the minor neurotransmitters are adenosine triphosphate, neuropeptide Y, and diacylglycerol and acetylcholine. They are the minor neurotransmitters. Whereas in case of parasympathetic nervous system, vasoactive intestinal polypeptide and nitric oxide are the minor neurotransmitter. Stability of the transmitter: noradrenaline is stable, diffuses for wide action, whereas the acetylcholine is rapidly destroyed locally. It is rapidly destroyed and it is locally by the enzyme acetylcholine esterase is the enzyme which is involved in the destruction of the acetylcholine. The important functions of the sympathetic nervous system are tackling stress and emergency. Especially to face the emergency or fight or flight reflex, the sympathetic nerve should be active, whereas the parasympathetic nervous system is having the assimilation of food, digestion of the food, and conservation of the energy and production of the energy. It is both are in opposite action. That's how the difference between the sympathetic and parasympathetic nervous system falls. Here you can see the muscarinic receptors are classified into 5 subtypes, whereas the M1, M2, M3, M4 and M5 type of the receptors are there. Whereas the M1 is going to act on the central nervous system. Of course, the M2 is present on the heart, M3 in the smooth muscles of the intestine, etc. M4 is once again M5 are in the central nervous system. Most of these are differently distributed. So, whenever the acetylcholine is acting on the heart, it is going to reduce the heart rate and the contraction. That's inhibitory in nature, especially in the heart. Of course, it's excitatory in case of the smooth muscles through the M3 type of the receptors. Here you can see that the varieties of the receptors M1, M2, M3 and M4 and M5. A little bit there are varieties of the antagonists. Lot of antagonist is there, whereas the atropine is a classical antagonist which is going to block all types of the muscarinic receptors. Of course, nicotinic receptors are not at all affected with the atropine. So atropine is going to block all M1 to M5 type of the receptor. Of course, another antagonist is there, that's the pyrazapine. It is more selective to M2 type of the receptor compared to the M3 and M1. Of course, the other type of the receptors are not blocked by the pyrazapine. Another drug, that's the AFDXC116, it is very specifically, it is acting on the M2 type of the receptors. Of course, the other receptor M1 and M3 are less affected. For DAMP, it's also acting on the M3 type of the receptors. The M1 type of the receptors are located in the neuron or the central nervous system, whereas the M2 type of the receptors are present on heart, smooth muscles and the neural muscles, and whereas the M3 type of the receptors are present on the endocrine smooth muscles and nervous tissue, whereas the striatum is supplied with the M4 type of the receptors. So the M1 type of the receptors, the amino acid composition is 460 amino acids are there, whereas M2 it is 466, M3 it ranges from 589 to 590, whereas M4 478 to 479, because the receptors are subfamily of varieties of the proteins. So these proteins do contain varieties of the amino acids, and the number is also changing from the M1, which is having least, whereas the M5, it's the highest, especially the M2, M3 is highest, and the M5 is 531 to 532.